OET speaking, sample test 3, stroke patient, physiotherapy. You see a 40-year-old salesperson who had a mild left cerebrovascular accident or stroke 3 weeks ago, resulting in lack of function of the right shoulder and scapula. The patient has been referred to physiotherapy but is unsure why, as he or she feels ready to return to work. Confirm reason for referral: physiotherapy following mild stroke. Find out how patient has been since stroke. Outline benefits of physiotherapy for stroke patients. For example, gradually building up strength, aiding recovery, etc. Find out about patient's job, physical demands, any driving, etc. Stress patient is not ready to return to work. For example, may delay recovery, unsafe to drive, medical clearance required from doctor, etc. Give information about recovery. For example, dependent on amount of damage to brain, therapeutic stimulation of muscles, fatigue, commitment, etc. Give information about physiotherapy program. For example, goal-based, aim, return to work, etc. Describe possible exercise types. For example, strengthening, stretching, etc. Establish patient's willingness to start exercises. You are a 40-year-old salesperson who had a mild stroke 3 weeks ago. You have been referred for physiotherapy, but are not sure why, as you feel ready to return to work. When asked, say you feel fine. You have some weakness, a feeling of heaviness, and limited movement in your right arm and shoulder, but you're okay. You don't really think you need physiotherapy. In fact, you feel ready to go back to work. When asked, say you work in sales, so your job does not require a lot of physical exercise, but you do need to do a lot of driving. You feel ready and want to get back to work as soon as possible. Say maybe you should wait until your shoulder is a bit better. Ask how long it will take to recover. Say you don't really know what the physiotherapy will involve. Agree to work with the physiotherapist on an exercise program. Good afternoon. My name is James. I am the physiotherapist on duty today. Could I just get your name and your date of birth before we start the consultation, please? Hello, James. My name is Bryce. My date of birth is the 1st of March, 1984. Nice to meet you, Bryce. As I understand it, you're here today because you've had a stroke and you've been referred for physiotherapy. Is that right? Yes, that is correct, James. Okay, I'm sorry to hear that you had a stroke. I hope you're feeling better. I am here to help ensure you have a speedy recovery. Are you feeling okay? Yes, I feel fine. Thanks for your concern. Do you mind if I ask you a few questions to see how you've been since the stroke? No, not at all. So, how are you feeling these days? Do you feel any weakness? Yes, I do have some weakness, and to be honest, I have a feeling of heaviness and a limited amount of movement in my right arm and shoulder, but I'm doing okay. I really don't think I need physiotherapy. I'm dying to get back to work. I understand that you're keen to get back to work, Bryce, but it's very important that you get some physiotherapy, as it's really beneficial for stroke patients and can help gradually build up your strength and aid immensely in your recovery. Are you following me? Okay. I'm beginning to understand that physiotherapy might be useful, but I'm just getting bored at home and really want to get back to work. Sure, I understand it's not easy recovering from a stroke, Bryce, but try to be patient until you are recovered completely, and that will ensure you don't have any further issues going forward. Are you following me? Yes, you're making sense, James. Thanks for your advice. Let me ask you some questions about your job. Is that okay? Sure. Do you have a physically demanding job, Bryce? Well, I work in sales, so my job doesn't require a lot of physical exercise. I see. That's good that you don't have a lot of physical demands at work. What about driving? Do you need to do a lot of driving? Yes, I do need to do a lot of driving as part of my sales job. I could typically drive more than 1,000 kilometers a week, and I would like to get back to it as soon as possible. I understand, Bryce, but let me give you some information about your recovery. The recovery really depends on the amount of damage that has been done to your brain, and it's very important that your muscles get some therapeutic stimulation to get them working normally again. Is that clear? Yes, you're starting to convince me now. The recovery also depends on the amount of fatigue you are feeling and your commitment to the physiotherapy program. How do you feel about that? Well, I don't really know what the physiotherapy program will involve. Could you explain it to me? Sure, Bryce, no problem. So, the physiotherapy program is a goal-based program, and our aim will be to get you back on your feet and back to work as soon as possible. How do you feel about that? Yes, that sounds great. I'd like to get back to work as soon as possible. So, there are some possible exercise types that we normally do with stroke patients. These include strengthening exercises, stretching exercises, and other types of conditioning exercises to get your muscles back into good condition. Are you willing to start doing these exercises? Yes, I'm willing to do the exercises. Definitely. I want to get this problem sorted out as soon as I can. That's great, Bryce. I will get a physiotherapy program created for you, and we can start as soon as you're ready. Thank you for your time today. Thanks, James. I'll see you soon. Bye bye. All the best, Bryce. Pause the video and practice. Please like this video to help me build this channel for you. Thanks for watching. Good luck with your studies. Stay motivated. You can do it.